Hi, everybody. Welcome to the Jon Myer Podcast. Today, we're talking about the importance of digital employee experience, DEX, in modern healthcare. And joining us today is Marcel, the America's Field CTO at ControlUp. Marcel, thank you so much for joining me.
Thank you for having us.
Marcel, we got to talk about DEX. And when I think about the digital employee experience, I think of all the memes, the Saturday Night Lives that happen for the IT calling up the help desk and be like, my printer's not working. And be like, did you reboot it? So for me, the digital employee experience is having a good experience on a one-to-one of solving a problem with your employee. But talk to us a little bit more. What is DEX?
So thank you for having explained already what digital employee experience is, the acronym. Some people don't really understand it, but
Yes.
You started with the best example of it. As an IT professional and as an IT director or CIO, the last thing you want is that your level one starts the conversation with, did you reboot it? They should have that data, right? So digital employee experience starts by the person on the other side of the phone being able to tell you, hello, John, I know you're on a Mac or on a PC. I see that you rebooted it this morning and that you seem to be having problem with this application. Let me see how I can help you with that. Notice that I didn't start with, let's start by rebooting your computer. I had some insight, right? I come prepared to, as an IT level one, level two, level three, I come prepared to that meeting. And I always tell the story that not always can you prevent an IT incident, which is the best outcome of digital employee experience is an incident that never happened. But if I know your computer is going to blue screen in 15 minutes, because I know we have a time limit today on our chat. If I tell you it's going to blue screen in 15 minutes, it's still going to blue screen, but you'll manage your time prior to that blue screen, and it's a completely different experience than the blue screen just happening and me calling you after or you having to call. So digital employee experience is let's call it predicting, definitely predicting, having the information to predict what is happening to the users, being able to have it never happen, and if it does happen, being able to resolve it as quickly as possible. So I think that sums up digital employee for me.
Marcel, when I think about that, first of all, that is next level IT. And I can't call it like IT help. Hey, I want to call the DEX department. Actually, that's what we should rename it, right? So we want a good experience around it. If you could predict blue screen of death, right, before it's going to happen, the employee would be like, all right, it's going to happen in 10 minutes. You know what? I'm going to get what I can. I'm going to go grab some coffee. It's going to reboot and come back. For me, that is very productive. And if I could actually call up the help desk or the help desk calls me and say, hey, listen, we noticed that you reboot. You're having some errors and issue on this. Let me see if we can fix this for you. Or A, we've already fixed this for you. Have a nice day.
Spot on. So this is really what digital employee experience is about, right? I know a lot of people when they hear what we do, and I think we can get into that in a minute. The first thing they think is, oh, you're spying on me. No, we're not spying. It's not spying on your employees. It's actually having the metrics, having the data to predict what problems might they have, prevent the problem if possible, and resolve it as fast as possible. So I think, and it's.
Oh man, you opened up a little bit. Okay, first of all, we're not going to go to the whole trust and you analyzing employee data. That's a whole separate podcast for our topic, because there has to be a level balance there between the data that you're receiving from an employee in their computer, making sure it's anonymized. I mean, how many employees, and this is way off topic, but I got to say it is, hey, why don't you take this anonymous survey and be like, no employee believes that it's anonymous. So now you're collecting the data where it's coming from. Yeah. But the employee doesn't feel that they are, no matter what, but going on to it. Now, at this point, you and I have to have a separate conversation on it, because that is another employee experience. But what I really want to kind of touch on is the trust of, not only having that digital employee experience, you have to change the mentality of an employee calling up IT and be like, I got to call IT today. That's going to be a horrible call. and having a good experience. Like, man, IT is awesome. Let's call them up. They're going to solve this right away for us.
Yeah, definitely. So you know, it's and I want to add to what you said, because it's not just the employee calling IT. And it goes to an anecdote that I heard from a hospital worker in IT, which they had gotten to a point before they got our platform and had really got a handle on the digital employee experience. They were at a point that nobody wanted to take the on-call shift in the IT team, because they knew that things were going to happen, and they knew that being on call didn't mean that you had to be ready to pick up the phone. It meant that you would be working for the next 8 hours that you were supposed to just be on call, because every little thing that happened, there was no quick way to fix it. The other thing is level one already knew that if they had a call, they had to call level one, level two in the middle of the night. And what they did with ControlUp is they were able to empower level one, that person that picks up the phone, to greet you with some information that they already have, and even have a scripted resolution that with one click they could fix it, right? So they shortened that time to resolution. They even shortened it, and they shortened it to zero, that the best incident is the one that never happens, or the one that happens without the impacting the user. So this is you're definitely spot on, right? A lot of people.
Hey, listen, I was there. I did the on-call. I did the level 1, the level 2, level 3. I know the experience of this. I lived and breathed it. And just like you said, when you're on call, it's not, I'm just going to get a call and work a couple times. You are going to work that additional 8 hours. Marcel, I know we only have so much time on this. I want to talk about how DEX relates to healthcare.
So first of all, healthcare is 24/7. I think we already spoke about that on-call shift, which is actually a full shift. It's also an industry where time matters, right? In two reasons. The first one, the most obvious one, is if somebody's treating an urgent care, is in urgent care, being able to know whether this patient data, get to the patient data so that they can know whether they can use some type of drug or another to help the patient is important. They can't wait to get the data. It has to be available. Systems have to be up and running and available. The other thing is, we've all been to a doctor, and we hate the fact that they come in, talk to us for 5 minutes, and then they move on, right? So if you think about it, a doctor and a clinician in general goes from one place to another, to another, to another, multiple times a day. So if they have to wait 10 to 15 to 30 seconds to log into their system every single time, and then another 10 seconds for the application to start, we just spoke that they burned 40 seconds of that 5 minutes just waiting for IT to deliver. So it is actually, I found a statistic that the average healthcare employee can spend 30 minutes waiting for IT a day. So 30 minutes a day, that adds up pretty quickly. And those are 30 minutes that they can't be productive, that they can't serve patients, that you have to wait yet another week for an appointment at the doctor.
Marcel, talking about frustration and some of it, you talked about just the, waiting 30 minutes for something to come up. I was at the doctor the other day. They had the door open, and I can hear the lady saying on one computer, and now these were VDI machines, right? And most healthcare providers have that because it just makes it simple to hop from one to the next.
Secure. Yep.
Yes, very secure, which is, healthcare, thank goodness. And they were saying, hey, listen, do you want to see this x-ray? Oh, it's not coming up on my machine. Well, that's weird. And they were talking about it for 10 minutes. It's not coming up. Then a lady tries on another machine and it's showing up. She goes, wait a second, it just wasn't working. Now it's working on here. It's so confusing on this. I want to really talk about if you had true real-time visibility and actionable insights, how could you automate this remediation of the issue?
So the first thing is understanding that you have to look at everything that involves the system, from the keyboard, mouse, monitor, the thin client, or the device that they're using, to how they're connecting to their VDI or the backend systems and what's happening on those backend systems. If you can't see all of that, you end up with a piece somewhere. Maybe it's the network or a DNS entry on that machine that's frozen. All of those things can lead to the fact that they can't get from one place, but yes, from the other. And ControlUp is looking at everything. We're collecting data very frequently. Our product is able to collect data every 3 seconds, which is amazing that we're able to do that at large scale. And we're able to pinpoint when a blip is happening. Maybe a device is running Windows updates when it shouldn't. But if you don't have the metrics and the information to say that device is not connecting because it just happened to run Windows updates and it doesn't have the bandwidth at that point in time, then you can't know it. So having the data is paramount, and then being able to connect the dots to be allowed to perform those corrections.
Marcel, I got to ask, you're having all this data, you're pulling in all this data. What are the false positives like?
That's so. Yeah, I think we've all used Excel. Let's use Excel for it.
Never heard of it.
Never. So you open Excel and you start doing some calculations and you just hit F9 and you load data from a data source. Excel is going to spike up the CPU and the network on your computer. There's nothing about it. It is working hard, and that is normal. So while you're collecting data, often you need to know, is that spike just because you were doing something for 10, 20 seconds, or is that spike prolonged? So you need to be able to look at everything that's happening and be able to define what is the threshold for things happening. So high CPU, or maybe getting into an elevator and having low Wi-Fi while you're in the elevator with your laptop, right? You need to define how long does it really need to be in that condition to be able to act upon it. So if you're collecting data every 5 minutes, you don't have the luxury of saying, well, if I get one bad reading, let's wait for the next reading in another 5 minutes, because that's already an interruption if you think about it. But if you have data every 3 seconds and I get one drop Wi-Fi, two drop Wi-Fis, three drop Wi-Fis, again, at that speed, I can say, okay, if you get 5, I'm going to do something about it. If I get 2 or 3, I'll consider it a false positive because it's a transient. But to be able to ignore the false positives and the transients, you need to be able to have a lot of data, which is what we do. A lot of other solutions look so infrequent that you can't really ignore a transient. You don't know if it's transient or if it's been like that for 5 minutes because they haven't brought the data for 5 minutes.
What is the importance in the relationship between DEX and optimizing patient healthcare, though?
So, as we talked on the example, right? If patients or clinicians really are, that their time is at a premium, and you want those 5 minutes or 10 minutes that your clinician or your doctor is going to give to you, you want them to invest that time with you, not to invest that time in waiting for technology or interacting with technology and waiting for it to respond. So the more we can help that the technology is ready and it's not an obstacle, but it's something that can be immediate, that it's readily available, the better the patient experience.
Marcel, can you share any like real life customer stories about the impact of DEX on even like a clinical setting?
Sure. So log configuration is unfortunately one of those that happens quite a bit. If you misconfigure something, maybe a policy that needs to apply to certain employees only, you could end up with a user having to wait upwards of a minute to log into a system. That definitely, will kill the experience. If a doctor comes in and these are, we've seen it where the doctor comes into a room and they simply can't log in. So they take notes on paper and then they have to leave it, and it gets, basically it's impeding them serving the patient because they can't do their job because of those systems not being available. The other one is being able to detect within a hospital, for example. It might be a specific area where the Wi-Fi just doesn't hold up. And that one, by the way, it can happen anywhere in any industry, right? I recall at one of my previous companies, we knew that there was a conference room that you had to come in with a wire because the Wi-Fi was just horrible in that room. And if you didn't come in and wired yourself to the wall, there was no way you could have a meeting in that room. Well, clinicians don't have that. You need to be able to pinpoint which hotspot drops the packages. And if you can pinpoint that every employee is having a problem when they go through this corridor, now you know where the problem is. And sometimes you don't have that data without a good DEX monitoring platform.
Marcel, before I wrap things up, I know the HIMSS conference just happened. I want to talk a little bit about that. What was it like there?
So I want to break the HIMSS experience in before the pandemic and after the pandemic. Because before the pandemic, and I'm talking in the 2017, 2018, it was definitely a conference where you see a lot of the nursing teams coming to look for the hardware and the consumables to modernize their practices. The tags with the barcode, or the barcode reader, or the drawers with that they have to tap and go to be able to open the drawers. It was mostly about that. You could see it at every corner, right? It was more of a hardware and consumables show than hardware and consumable in the technology space, but it wasn't just the software and the services. I think with the years, and I did miss a couple throughout the COVID years, now it's really about the services and the things like DEX and cloud, and how do you get your patient records analyzed better, or the billing, right, software. I think it's going in that direction, right? It's more of those sort services and software more than the hardware and consumables. They're still there, but the balance has changed.
So it's more of a mix that's going on there, and more around the not only the customer experience, but now it's centered around maybe the employee experience to fine tune and how to do their job a little bit better, more efficient, and stop spending time waiting for services to actually come up or to work.
Yes, and again, the billing is one of those that comes to mind, or accessing patient records, or moving things to a web-based, all the web-based platforms that are available today. So there's a lot of offerings there, a lot of security companies as well, with every possible security solution. So it was definitely interesting. And they did spread it out physically. So one of the things I recall years back, it was just very crowded. This year it felt, there was a lot more space, definitely a lot more walking, but it was nicer, right? You didn't feel crowded as much as years prior.
Marcel, we haven't talked. There's so much we could have talked about. Security is one of those, and I don't even want to jump on that yet, because that could be a whole nother conversation for you and I. Maybe something we need to do in the future to talk about the digital employee experience, and then also how security relates to that, because there's always that friction and communication.
Yes.
I need to get my job done, but security's blocking me. Well, you don't need access. If you want me to do this, I do, or else I have to bring in another person. Marcel, I'm going to have to tap you that you and I are going to have to do another podcast around just the security and digital employee experience.
For sure, that's definitely a topic, because it does the two conflicting sides of IT, and the best outcome is to find a happy medium where security is satisfied without impacting the user experience.
And I think when you get the security and the friction there, it does impact the patient experience, because the employee is not happy.
Of course.
The patient is not going to be happy. They already don't even want to wait 20 minutes in the doctor's office. Now they're waiting more because they can't access it. And, employees are just complaining that they can't get their job done. Well, Marcel, thank you so much for your time. I really appreciate it.
Likewise. Thank you for having me.
Well, everybody, we were talking about the importance of digital experience, or DEX, in modern healthcare, and joining us was Marcel, America's Field CTO at ControlUp. I'm Jon Myer. Thanks for watching the Jon Myer Podcast. Don't forget to hit that like, subscribe, and notify, because guess what? We're out of here.